Hello and welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Very glad that you could join us again. Going to be speaking with Dr. Wesley Gilson this morning, Artificial Intelligence Lead for Siemens Healthineers North America. And he's joining us here on the program to talk about the idea that AI revolution in healthcare is not inevitable. Welcome to the program, Dr. Gilson.
Thank you very much, Neil.
As AI lead for Siemens Healthineers, give us a brief background about your area of expertise, and then tell us what you think is the most interesting application of AI in healthcare as we're dealing with things today.
Sure, I'd love to, Neil. So Neil, my background actually is in biomedical engineering. Got my degree, my postdoc, or my graduate degree there, and then did a little postdoctoral fellowship in the Department of Radiology and Radiological Sciences at Johns Hopkins University before I joined Siemens Healthineers. And my expertise really falls into that space of medical imaging, and then the kind of have worked in the application of various forms of machine learning as they apply to medical imaging. I've led a team that was focused on developing numerous new techniques with a heavy focus on supporting the use of imaging to guide minimally invasive surgical procedures. And that really got me into this space. And now as the artificial intelligence lead for our North America business, I really look at cross-business activities that we have going on in that space. And that's allowed me to work with a lot of amazing colleagues around the world that are developing these techniques. And as you asked, what the most interesting applications, if you will, of AI in healthcare today, that's a tough one because there's tons of work going on these days. Lots of amazing AI applications are being developed every day from tons of different companies and individuals even around the world. I personally am most excited about AI applications that are being developed for therapeutic clinical decision support. Neil, you might ask me, what do I mean when I say therapeutic clinical decision support? I like to kind of put this with a nice analogy. Consider a map, for example. Imagine for a second that a patient's been diagnosed with a certain disease or disorder, let's say, for example, prostate cancer.
Okay.
This patient now begins a journey. So you're on this map, you begin a journey, and hopefully everyone's goal is being cured. So my destination is being cured and being rid of the disease, in this case, prostate cancer. So the path to that destination, though, is not quite the same for every patient, may be different, and it can be guided by a lot of different inputs. So different risks may be considered, different preferences may be considered. Even the map may change over time. You can imagine that map might change as you build new roads, or in this case, you build new therapeutic inputs or new therapies that might be, or new tests that might be able to guide you on this map. And so if we then consider, if we then kind of step back for a second, you can imagine back in the day, you had a physical paper map. We all grew up in the time where there were physical paper maps. I have children now, and I don't know that they necessarily even consider that. They look on their phones, or we use navigation systems and GPS systems. And what's so great about these GPS systems, right, is that they take lots of real-time input, and they can modify our routes or paths based upon the various different inputs, whether that be current traffic conditions, construction zones, toll roads, weather conditions even. And they use that information to provide you choices on the best strategies or the best routes for your certain preferences. You can actually put in, I want to take the fastest route, or I want to take the shortest route, or I don't want tolls. Or, for example, my sister really doesn't like bridges. So you could potentially put that in as a factor and say, hey, that's going to take me a different route. Well, similarly, we can think of that when we're talking about clinical decision support, employing similar decisions or strategies there. And this is really what excites me, because now we can take AI and we can use AI to develop these maps and to really modify pathways for individuals. So we can move towards this personalized precision medicine approach. Now, I will say we don't have complete solutions in place, but to me, this is one of the most exciting areas, and software, and we can start to really guide care in the most appropriate way. And really, it builds on evidence-based medicine. So, I think that's probably the most exciting one for me at this point in time, although there's tons of applications for AI at the moment.
How has Siemens Healthineers approached AI as a tool for tackling this current pandemic? Lots of challenges need to be overcome. Talk about some of those challenges that you think that Siemens can overcome during this pandemic.
Sure. So I have to say I'm extremely proud of the company I work for and what they've been doing to do their part in helping to address COVID-19. Our in vitro diagnostics business has done an amazing job developing things like molecular and serology assays for detecting COVID, and then also for tracking antibodies associated with it. But in the world of AI, I would say a lot of our effort has been focused, again, on one of our core businesses, which is medical imaging. And in that domain, we've been targeting the automatic identification and quantification of abnormal patterns that you might see in both X-ray imaging and computed tomography images. And so along those lines, AI, machine learning, particularly deep learning, are being employed, and that's really predicated on data. So deep learning, machine learning really requires data in order to be able to draw strong algorithms or develop strong algorithms. And so one of the biggest challenges I would say that we've had in our development of solutions in that domain is access to data. You can imagine that there are a couple of different scenarios. One, you've got a focus of healthcare providers that are working to take care of their patients and not necessarily focused on, hey, how can we develop a new, or how can we contribute to the new technologies of some of the companies that we work with. We really need to take care of our patients now, but I have to say we have a really strong partnerships out there, strong collaboration partners that have been awesome in this process. And they have, as they've gotten cases of COVID patient cases, as well as some cases that might feed into the algorithm development overall, they've been great in partnering with us, working with our scientists and our engineers to develop solutions that I think will make a big impact on really delivering, or will make a big impact on helping physicians and helping healthcare professionals to take the best care of those COVID patients going forward. And these types of solutions really can do a ton of different things. They can help radiologists better detect, characterize, and track the progression of some of these radiological abnormalities that are associated with COVID-19.
The face of healthcare has changed. It's not changing. It's a done deal. It's changed. Is AI going to replace the imaging technician or the technician across the board going forward? And especially with this explosion in telehealth and telemedicine, is the technician going away?
You know, Neil, that's a great question. And I think there have been some anxieties raised there. But honestly, I don't believe that that's true at all. I think that the AI technologies that are being developed today are intended to better enable technologists and better enable healthcare professionals to focus on the patient and deliver the best care by reducing things like variability between those operators, between those technologists, for example, by being able to speed up the overall workflow, so allow them to push the patients through, and also just enable them to focus on the patient and on the most valuable tasks rather than having to focus on some of the menial tasks that oftentimes take up a lot of time, but don't necessarily need to be. They can be quite nicely automated, and AI is a great, AI provides a great opportunity to get rid of some of those menial tasks.
Give us a website where we can learn some more about Siemens Healthineers.
The best website to go to is www.siemens-healthineers.com.
Dr. Gilson, I appreciate you hanging out with us this morning here on Health Professional Radio. It's been a pleasure speaking with you.
Thank you very much, Neil. You have a great day.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Wesley Gilson. He's the AI lead for Siemens Healthineers North America. Audio copies of this conversation are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.